Hi, I'm Dr. Michael Ramsey, and I just want to give you a little information about swine flu, or the H1N1 flu that so many people are talking about now. The reason why this virus has gotten so much attention in the media lately is because it is a new strain of flu which is causing a pandemic. Now, a pandemic does not mean that it's necessarily a more severe strain of flu, but it means that very few people have immunity to this strain of the virus, and so many more people are going to get this than in a typical flu season. To help prevent the spread of this virus, there are several things that you can do to keep yourselves and your children safe. First of all, what everyone can do is if your child is sick, if they have fever over 101, they need to stay home. That's even if they have fever the evening between 8 and 12 that night, and then that next morning, if they're fever-free, they still need to stay home from school that next day. Some other things that we can do to help protect ourselves, obviously hand washing and using hand sanitizer like Purell is something that's very effective in helping prevent the spread. Also, trying to teach children who are a little bit older to cover their coughs and sneezes, or cough or sneeze into the corner of their arm, in their elbow, would be helpful as well. If you do contract swine flu, the symptoms are very similar to what you would see with a normal flu virus. Typically fevers in the 101 to 104 range, some body aches, sore throat, cough and runny nose. Fortunately, with this virus that we're seeing right now, we're not seeing a lot of complications with swine flu. So we're not seeing a lot of people having to go into the hospital. Right now we're not seeing a lot of complicating pneumonias or ear infections with this. However, with the very small children, we can expect that some of these complications may occur. If your child does contract swine flu, or they do have flu-like symptoms, it'd be important to treat them with Tylenol and Motrin for their fever, to make sure that they are taking plenty of fluids, that they're staying well hydrated, and then you can talk with your doctor's office. Usually you do not need to run to your doctor's office within the first 20 to 30 minutes of having a fever. There's very little that your doctor can do at that time. So most of the time we recommend the day you have the fever, go ahead and treat the symptoms, and if they persist, then trying to come in the next day. The main thing that I want you to remember about swine flu is do not panic. This is a very common virus that's coming at us in a new strain, so more people are going to get it, but it is not necessarily more deadly. It just is very much more contagious. And so with proper treatment and supportive care, most children will come through this infection fine.